So many people are looking to live happier, more stress-free lives. We provide interviews from mental health experts across various fields because we know finding quality information isn't always easy. Let's find more sanity together. Hello, everybody, and welcome back to another episode of Sanity Podcast. This is another one of the ABCT Sanity collaboration series. Today, we're going to be talking about parent-child interaction therapy. This is a training course that I actually just did with Corey, who I'm going to introduce. So I just learned some about it, but it's a really awesome, cool therapy for people that haven't heard about it, learned about it, want to learn about it, working with children. Our guest today, we have Dr. Kate Gibson, who's a clinical psychologist. She has been certified as a therapist and within agency trainer by PCIT International for PCIT, and PCIT is short, of course, for Parent-Child Interaction Therapy, and by Kurtz Psychology Consultation for PCIT for selective mutism. She is board certified by the American Board of Professional Psychology in clinical child and adolescent psychology. Her clinical and research interests include childhood trauma, anxiety, selective mutism, OCD and OC-related disorders, disruptive behavior, and providing training and consultation in these areas. Dr. Gibson is co-author of Parent-Child Interaction Therapy, Adapted for Older Children, a research development manual, which is particularly important because we're going to be talking about that in our second episode, how to do this therapy with older children. We also have Dr. Corey Lineman, who is a certified therapist and within agency trainer through PCIT International as well. She is a licensed psychologist and assistant professor in the Department of Psychiatry at the University of Nebraska Medical Center. She specializes in research, diagnosis, and treatment of disruptive behavior in children ages 12 and younger, with particular focus on children with autism, ADHD, anxiety, trauma, and attachment diagnoses. She also has expertise in treating sleep disorders and conducting trauma-focused CBT, or trauma-focused cognitive behavioral therapy. She has authored several research-based publications and co-authored the book Timeout in Child Behavior Management. Both of you, welcome to the show.
Thank you for having us.
Thanks for having us on.
All right, so just to get started, in a nutshell, what is PCIT and why should people care about it?
Great question. So PCIT is one of the most evidence-based interventions for child disruptive behavior. It was originally developed by Dr. Sheila Iberg in the late 1970s. And since that time, it's been researched on thousands of kids all over the world. And it was originally developed to treat kids between the ages of 2 and 7 years old. And it's really targeting the parent-child relationship as a mechanism for change. So if you have a 2 or 3-year-old coming in for therapy because they're having tantrums, they're getting kicked out of preschool, it's really hard to bring that child in one-on-one and talk to them about their feelings and their behavioral choices and then send them home for a week and have them get better. So we have to involve the parent-child dyad. So it's a 2-phase intervention. And the first phase is about strengthening that relationship, because when you have a kid who's having behavior problems, the relationship really gets strained. And a lot of times parents and kids get sucked into power struggles. So we really work to improve that, make it more positive, and teach parents some behavioral therapy methods that we would use. And so they can use them all week long at home. And then the second phase is more about giving good instructions, helping kids follow rules, and learn to do that discipline piece calmly and effectively. So using that method, all kinds of different diagnoses and populations have been included in the research over the years. And so if you look at the effect sizes for PCIT, it is just blows most other treatments out of the water, which is a great thing, and we love it.
Well, I love the pride in that. Like we're doing so good over here. I mean, just for like the effect sizes that we're talking about, small, medium, large, just to help people throw it in a bucket.
Very large.
Very large. Okay. All right. I'll take it. A lot of people know about.
There was actually a study done in Oregon that had an effect size that was 0.7 for those who attended 4 sessions and 1.65 for those who graduated from PCIT.
Wow. I mean, if you don't know those numbers, those are big numbers.
Yep. And I was part of that study. So across the state of Oregon, they rolled it out across the state. So these are not, university-based, squeaky clean clinical trials. These are real families and real homes, and it really works.
And I think just to add on to the fantastic description that Corey gave, there are several parent training programs out there for children with disruptive behavior. But I think one of the things that really sets PCIT apart is there's a focus on data every step of the way. We're coding each session. We're having assessment measures completed. And then a really big standout is live coaching. So we're live coaching that dyad, that parent-child dyad, in the moment, giving them feedback on the skills and how to tweak them versus having them apply it at home and then come back and tell us about it. So we're watching what happens from behind a mirror or behind a camera system and giving them that live in the moment feedback.
And I think you mentioned that you're actually scoring a form in order to go back with the parent and say, this is what's going on. And this is an area where you scored a little bit lower, but no problem. Let's work on this area in order to get them up to par in all the different domains that you guys are hoping to work on.
Exactly. So we have benchmarks for the specific skills that we're trying to support the caregivers in reaching so that we know they have a really good handle on those skills. And that's one of the criteria that we use for moving from that first phase Corey talked about to the second phase. We want to know that they're so comfortable with those positive reinforcement skills in the first phase that when we add in the second phase, they're going to be able to add in a new skill set more effectively.
So it's a bit modular, but in a way that you graduate. So it's not just we're going to move on to the next module because that's session 3, but because we got the skill acquisition in order to move to the third module.
Exactly.
I'm just saying 3 for some random reason, but in principle.
Yep. And it's designed that way for a reason so that every single family who makes it through to the second phase has been successful in the first phase. And every single family who graduates from the treatment has been successful. So it's not time limited. And I think that's one of the secrets to success.
Yeah, I was literally thinking that's probably where part of the effect side, but besides having good techniques, is that you're making sure that people are graduating along the way and really knowing how to do that skill before jumping to another one. For people that do behavior child therapy already, and they're listening to this, how would you say it diverges? Like, what's different that they should be listening and thinking, maybe this is something else I should add to my toolkit?
That's a good question. I think Dr. Gibson hit on it. It's the coaching, it's the acquiring the skills, and I think that Dr. Cheryl McNeil, one of our mentors who was a developer of the treatment, uses this analogy a lot. And it's like if you went to a tennis pro and you wanted to learn how to play tennis and they sat in the tennis pro's office and talked about tennis for an hour every week, would you get better? You'd get somewhat better. But if you really got some coaching and you got in there and did it in the session, then would you get better? Yes. And so therapy is the same way. Getting a parent to try these skills live and get feedback is a piece of the toolkit. And I would also say the pride skills, which is the core of the first phase of treatment. I use those all day long when I interact one-on-one with kids. I hope that parents learn that so that even if they're working on something totally different, like they're working on anxiety or OCD, if they're able to use those pride skills, which we can talk about more, it can really bring out more positive behavior in their child. And the parent gets to choose ultimately what that behavior is that they care about, that they're trying to reinforce. But when they have the pride skills under their belt, and I would argue even a therapist having those skills under their belt, they can really pull positive behavior in a lot of different domains out of anybody.
And I think because we're getting to see those live interactions, so we talked about there's quantitative benchmarks we're looking for to move from one phase to the next. But because we're getting to see them live in action, we always get to focus on the qualitative as well. Like, how is the parent talking to the child? How is the relationship responding to the use of the skills, and really nuance not just what they're doing, but how they're doing it.
You mentioned before, and you mentioned now, like kids with various, like it's been validated on various different conditions and disorders, but it is to work on particularly like defiant behavior, right, and trauma. So, what is the nexus here? Say that you have a child with OCD and defiance. Does it treat the OCD as well, or is it just validated that if they have OCD, it helps the defiance, and then they have to treat the OCD separately?
Right. So the research is on treating disruptive behaviors. So not diagnosis specific. So it could be an array of disruptive behaviors. Maybe they meet criteria for ADHD. Maybe they meet criteria for ODD. But standard PCIT is really about disruptive behaviors. Sometimes kids with clinical disruptive behaviors have other things going on also. So I would say anecdotally, in my experience, we are not necessarily targeting specifically anxiety or OCD, but we often, because we're improving that relationship and we're introducing so much positive reinforcement, we often see improvement in other symptoms also. But sometimes at the end of PCIT, you might still have obsessions or compulsions, and you might need to transition to ERP afterward, but it's probably going to go more smoothly when you have a much more cooperative kiddo and a much healthier parent-child relationship on your hands. And there are some specific adaptations of PCIT that have been developed for clinical populations as well. So there's an adaptation that targets anxiety. There's an adaptation that targets selective mutism, which is a form of anxiety. And those can be delivered to those anxious populations without people having to go through standard PCIT for the challenging behaviors.
Yeah, I was going to mention those interventions as well. So you are one of the originators or one of the best practitioners of those models, being out of the Kurtz group. Would you say the names? The CALM program is for anxiety, correct? PCIT
Correct.
CALM?
Yeah, so that was developed, I believe, by Dr. Comer, and that targets young children who are having maybe a phobia or separation anxiety, some anxiety disorder that you're targeting because of their young age with the parent jointly. So in the adaptations that exist for clinical populations, that child-directed interaction, that first phase that's focused on positive reinforcement, is pretty similar throughout all of them. So, Dr. Iberg figured out a really good way to help parents connect and heal their relationship or improve their relationship with their child and create a lot of positive reinforcement in their interactions. And so that foundation can really help children be able to face a variety of challenges. In the anxiety adaptations, normally, after that foundation of positive reinforcement in the child-directed interaction, then we move into exposure-based interventions with the support of the parent there. So it's still the dyad, and we're coaching the parent to be able to manage exposures outside of the session too, and to kind of do what we call like living an exposure lifestyle. So throughout the week, you're going to be doing exposures. You're going to use your positive reinforcement skills. You're going to use your anxiety exposure skills that you're learning in the context of this PCIT adaptation. And so I think it pairs really nicely with the PCIT model to have these adaptations available.
That's very cool. I had no clue that those were out there. And so, I mean, I think that's absolutely amazing. Just to find exposure, I have like 1,000 exposure episodes on the podcast, but in a nutshell, it's helping someone face their emotional discomfort in a non-avoidant way in order for them to conquer or move past it. And that's a very small definition. But one word that or phrase that you've said over and over again is positive reinforcement. So do you mind just quickly defining what you mean by positive reinforcement?
Sure. In the context of PCIT, we're giving parents words to use to verbally reinforce behavior, meaning they're going to pay attention to positive behavior their children are showing through their words. So this one strategy is a labeled praise, is what it's called in PCIT. So thank you for sharing that for me. So the parents are using their language to point out the behaviors they like and the behaviors they want their child to do more of. And so they give very specific praise when the behavior happens in the moment, so that the child is therefore more likely to do that behavior again because they're getting attention for it. So we're teaching the child that when they behave in these positive ways, their parent is going to notice it and say it out loud and pay attention to it. And therefore they do more of it.
I think culturally, at least around me, there's a habit to, particularly if there's troubles at home, and it doesn't matter if it's your kid or your wife or your husband or partner or whatever it is, that you tend to be very expressive when something's upsetting you or if there's a negative, but you don't spend too much time praising or acknowledging when things are neutral to positive, right? And I'm sure that I think people listening probably could resonate with that, and that's probably part of the thinking here is helping with the positive reinforcement. So we've been dancing around the child directed interaction and the other part of it, which is the parent directed interaction, which are the two main subsections of this therapy. So why don't we dive into the child directed interaction section of it? And you guys explained what the point is, but again, what's the point and how are you doing it and what are the various steps?
So there's a couple of points to it. One is building that relationship, calming down any power struggles that have been going on, helping the parent and child enjoy each other. A lot of times a parent of a child with behavior problems, whether that's hyperactivity or poor social skills or anxiety, a lot of the interactions become the parent trying to make the child do something. We have to make the child stay out of a busy street. A lot of parents really want their kids to go to school and put their seatbelt on in the car and brush their teeth. And so a parent tends to get paired with these demands all the time. So we're carving out time in the child-directed interaction piece where the parent gets to be paired with fun, enjoyment, happy moments, and so they can start to enjoy each other, and vice versa. It works the other direction as well. So we're asking parents to spend 5 minutes a day with their child one-on-one doing a variety of activities. We give them a list. It has to be a free-form activity that's very able to be child-led. So things like building, arts and crafts, where there's a good likelihood that there's going to be some free form interactions and the child gets to be in charge. That's the other piece. We want the child to be able to choose how to play, what to talk about, because all day long they're getting told by teachers and parents and everybody else, adults, what to do. So this is their 5 minutes of freedom that they get to be in charge. And then we're having the second part of it is having the parents get better at these skills, looking for positive behavior like you touched on. We're not in the habit of looking for positive behavior. Our brains are wired to find what's wrong and fix it. So we're retraining these parents' brains to look for the positive things and to reinforce them. And then we're also training them to underreact to minor misbehavior so that their kid is not getting a big hit of attention and excitement because they are whining or picking their nose or playing a little too rough with the toys. And through these 5 minutes a day plus our sessions, we're building up parent skills so they meet goal criteria. We're building up the parent-child relationship, and then we're ready to move on to the next phase.
I actually asked you this during a break during the training, and we'll go into more on like what you're doing during those 5 minutes. But well, what I asked you was like, it sounds like this is like an overcorrection where we're having the parent lean really far to doing things in a certain way with the idea that throughout the day, it will anchor them or pull them towards the directions of more likely to do these behaviors more globally, just like when an Olympic sprinter squats, right? They're not on the track squatting, but they do the squats to really strengthen emotion, which then allows them to more effectively sprint or do the functional activity that they're trying to do. Is that a fair analogy or assessment of why we're doing this 5 minute play?
Yeah, 100%. I think we're explicit also that we want them using the ideas throughout the week, but it's not realistic for them to give it their 100% undivided attention all day long. They have to look at their phone and cook dinner, and so we want that 5 minutes of undivided attention to the child daily, but we do help them think through how to incorporate those concepts throughout the day. And when we're not in the picture anymore, we want them to have learned these skills so well that when, they naturally decline a bit, they're still at a much higher rate than before they came to see us.
And the 5 minutes is kind of a reset that they have in their back pocket. So during therapy, during our 16 to 20 sessions or 16 to 20 weeks on average, they're doing this every day if they can. And then we are realistic. They're not going to do 5 minutes of one-on-one time every single day until their child turns 18, but they have it as a skill. And because they've gotten to be so good at using these skills at such a high rate, that it's a really concentrated dose of therapy. It truly is play therapy. And so if they get to a phase in the future where maybe it's been a couple of years since they've been in therapy, their child's behavior has returned or a new behavior problem has developed and they're getting into a lot of power struggles or their child feels really anxious, they can start to use that practice again and they can whip it out and kind of refresh those skills.
I love marketing in a way, and I'm just thinking like 5 minutes of play a day makes your parenting troubles go away. It's like it's a really good sell. I mean, you're like 5 minutes a day, and you could do so many great things.
So Dr. Dr. McNeil and I are in talks right now. We're writing a book, and that is a chunk of what you just said is on our list for titles. So you're right with us.
Yeah, no, that's great. All right. So when you're doing this 5 minute session, and you brought up pride skills, and like, what are you actually having the parents do, and what are you trying to get them to learn in that play session?
We're trying to have them learn labeled praises, which I was talking about a little bit earlier. So specific praises. We're trying to have them show that they're listening to their child by repeating or paraphrasing what the child is saying. So PRIDE is the acronym for the 5 things we want them working on. The P is for praise, and we want their praise labeled. The R is for reflect, which is repeating or paraphrasing what their kiddo is saying. That's how the kiddo knows they're listening, rather than the parent asking a ton of questions. We want them imitating the child's play. So staying at the child's level rather than competing with them, having fun and doing the same activity together to allow for interaction within the toys. We want them doing the D is for describe. So describing their child's behavior like a sportscaster play-by-play, narrating what the child is doing out loud, which is reinforcing for the child, even though it's neutral rather than praise. So, oh, you're drawing a flower now. You're building the Legos up really tall. That would be kind of a sportscaster play-by-play description. And then we want to package it together nice and warmly with the E for enjoy. So we don't want them, oh, you're building, you're drawing in a very monotone way. We want them showing authentic, genuine engagement and enjoyment. And that's the pride skills. And that's the positive reinforcement focus of the child-directed interaction, which we pair together with what Corey was talking about in terms of what we call active ignoring, which is we're going to catch all the positive behavior with those pride skills, and we're going to underreact to negative attention-seeking behaviors and show the kiddo all of this warm, positive, great attention from parent comes when you're behaving well, and that attention goes away when you do this minor misbehavior, but you can get it back really easily and really quickly by showing a positive behavior again. So we're coaching the parents through the timing, the use of the skills, the timing of the skills, and just helping them be able to read their child as well. And that's kind of what we're looking for in that pride skills CDI portion.
We talked about graduating along the way. What are some of the graduation points during this module or section of the treatment?
Yeah, so they've got to hit a certain criteria for the pride skill. So each session we start out with a 5-minute coding period where the therapist, the coach is quiet, and we are just taking data behind the mirror of how many of these skills a parent is using. And within that 5 minutes, we're looking for 10 or more labeled praises, specific praises of the child's behavior, 10 or more reflections, repeating back something the child has said, 10 or more descriptions, describing, narrating something the child has done, and then a good level of imitation, a good level of enjoyment. Those are a little harder to count. And then we are also looking for around 0. We allow up to 3, but people aren't supposed to know that. Combined questions. Questions are not terrible and bad for kids. They just lead an interaction. So if I ask you, hey, what'd you do this weekend? And you kind of have to answer me. It's kind of like a demand. And now we're talking about what I want to talk about. So we coach parents to avoid questions altogether during the 5 minutes. We coach them to avoid giving any type of commands or instructions, even something like, hey, scoot your chair up, hand me the purple marker, just because, again, this is, if they only get 5 minutes for the child to be in charge, we want them to be in charge as much as they can. And then we're also coaching parents to avoid any type of criticism or negative talk. So, hey, don't play so rough. Well, that's not the right color, things like that. So we keep it really positive. So those also have to be down below 3, ideally 0 combined for questions, commands, and negative talk. Any other pieces you would like to add, Dr. Gibson, for how you look at readiness to move on?
I think we're also looking to see that they're practicing at home. So if they're only doing their, we call it special playtime, if they're only doing it once a week, it's going to be hard for them to really sustain that level of skill when we add in. The second phase is about discipline. So we don't want to shift to discipline until we know that at home also they're using that positive reinforcement.
And my understanding from the training that I took, and well, 2 things. If you want to learn this, coding was really hard. So, actually going for the actual training and learning how to code with fidelity is probably a good idea. I think I did okay with my coding. I did not do great. On the other side of it, if I remember correctly, part of the goal here is to get the child very motivated about the parent's attention and the interactions. So having the attention interaction is very positive for them to get them to do the behaviors, the positive behaviors that we're looking for, and reduce the negative behaviors that we want. And then also if it gets taken away, that is a punishment because it's something that they want. So we can then use the parent's attention in order to help to craft the child's behavior.
Yes, and kids love this. If you get to a very research technical level, it sounds kind of cold and behavioral. We're only giving attention to a child when they're following the behavior that we want them to. But really, kids love this. They're getting such a high rate. It's so exciting. Kids almost always at the end of their coaching sessions here are like, oh man, I don't want to go. They don't want it to be over. They can't wait to come back. It also helps that we're not the type of doctors that give shots. And so that's really big selling point. But yeah, we're looking for parents who are able to do the skills. We're looking for families who are able to get the practice in at home. 1, because it's a habit and it's a lot of reinforcement, and 2, because our skills from the next phase have to kind of go into that practice mode. And if they're not making it a priority now, it's going to get to be a little bit more of a challenge to do it then. And then we're also looking for parents to get really good at that differential attention skill, we call it, where it is the turning on and off of my attention for specific behaviors. And it's kind of like a dance. And so when I see all those things, then I know I'm ready for the family to move to the next step.
Because kids want attention. That's how the vast majority are built. And if you're not going to get it in a positive way, then they're probably going to get it in a negative way.
Well, and typically it's been easier to get it in a negative way up until now. So we're shifting that paradigm.
Mm-hmm.
Yeah, we're increasing the positive because to a parent's credit, and if you have a child with, say, ADHD, I have a child with ADHD, they need a lot more instructions, corrections, and this is shown in the research too, than a child without that diagnosis. So I have to give 4 reminders where I might have to give another child just the original one. And so if we're not balancing that with a really high level of positive interactions, then it becomes unbalanced through no fault of the child or the parent. It's just a skill that we haven't learned because most parents don't need to develop that really high rate of positive interactions to balance things out.
So we talked on the positive side, which is nice, of what we want the parents to do. And we talked a bit about like what we don't want them to do, but are there specific things that we're looking to reduce during this play that parents tend to get caught up in?
It would be the questions, commands, and criticisms in terms of the types of statements we want parents to avoid. So even throughout the day, we don't expect outside of the 5 minutes, we don't expect no questions, no commands, but there's probably a lot of extra unnecessary questions and commands. So there might be room to reduce those unnecessary ones a bit. And then just like Corey was talking about, reducing that immediate attention to the negative behaviors. So that attention paradigm. Those are the things we're looking for them to reduce or avoid doing.
Okay. Any other main components of the child-directed interaction section before we jump over to the other section?
I think that's the main gist. The gist, yeah.
Okay. And you can't skip this step, right? So you have to graduate from this step in order for the next step to work.
It's the foundation of your house. So the foundation is the child-directed interaction. So we've got to have that strong foundation.
Mm-hmm. And there has been research, because a lot of times parents come in and it feels like, oh, this is just playing with my kid. How is this going to help? My child has bitten their teacher and gotten kicked out of preschool 3 times. So why is playing with my child 5 minutes a day? We hear that a lot. And so there has been research to flip-flop it and to do the discipline piece first. And what usually happens is that the power struggles are so frequent and tensions are so high in that relationship that the child is not motivated to please their parent. If a parent says, hey, go get your shoes, if I'm angry at you because we have this tense relationship, I am really not going to be motivated to turn off the TV and go get my shoes. But if we start out with the relationship building phase, it works a lot better.
When a parent says, why are we doing this first step? Do you ever say, well, we have a Cohen's D of 1.7 as a, I'm joking. Okay. So, but I would imagine that there are, how often does that come up though? Like where parents say, well, can't we just skip this part? That you actually have to workshop it.
They're coming in because they're having really big problem behaviors. So I think it's actually a frequent comment.
Okay. Yeah. So it sounds like it's something that you have to learn how to navigate regularly in order to get that buy-in.
Exactly.
All right. Okay. So let's jump into the parent-directed interaction module. So what are we doing in this section of the treatment?
Sure. In the parent-directed interaction, we're trying to have the parents learn and implement a very predictable, consistent structure of discipline. So we start by helping them use their words effectively, just like words are important in the first phase, words are important in the second phase. So we are teaching them some guidelines for giving directions to their children that make it more likely right off the bat that the child is going to obey. So we teach some rules about how to phrase your commands to make them what we consider effective. And then we teach a structured timeout sequence that has a script where you're really following the script to a T so that it's very repetitive, like a broken record. And we're teaching them how to effectively implement timeout in a successful way, because a lot of families have tried timeout with no success, and there are a lot of different reasons. And so you always want to explore with the family if they've tried timeout, if so, what that looked like, what the pitfalls were, and explain how this is going to be very different from what they might have tried already. And it's coming at a different time. We normally see about half the progress that we're going to see between CDI and PDI. So by the time we get to PDI, we've already made about half the progress we're going to make with the behavior. And we're using the parent-directed interaction to help them with the remaining issues. So we've got a more cooperative child on our hands by the time we start the second phase.
Are you still doing the 5 minutes of play a day, the same thing that you were doing, or does that morph into something else?
That's a constant.
That's a constant. Okay. So in the PDI part of it, it's getting more to now making demands or asks or trying to actually request behavioral change.
Yeah, and we call it listening practice, or at least I do. It's just like when you want your child to learn how to play an instrument or play a sport, you start with some easy steps so they feel like they understand it, they feel accomplished, the parents are even seeing some success. If we just give them a really difficult command, it's time to go to bed, and we give them a long list of things to do, and we're just going to see failure, and it's going to be frustrating on all counts. So we start with something small. It can be within that 5 minutes a day. At the end, we're having the parent give up to 4 simple commands. Sometimes we'll do play commands in therapy. So something like the child's coloring with the purple marker, the yellow marker sitting over here, and the parent says, please hand me the yellow marker. The child doesn't care. They're not even using it right now. So it's so likely that it's going to happen. And then the parent follows it with a specific praise, a labeled praise about how excited they are that the child listened, and then they get to go right back into the pride skills. So they get this high level of reinforcement, and we're teaching them over time that if I follow a direction right away, I get to go right back into that fun that I've established that my parent gives me. If I don't, the only consequence is that it's really boring, and that's the goal of our timeout procedure, is that it is so predictable and so boring for the child that it's really not worth their time and effort to try and resist it, because it's so easy to comply and get that command done with than it is to miss out on several minutes of that really fun interaction.
So you're starting small with the idea of building up the idea of listening to your parent, and then you increase that task demand as you go. And I would imagine that just in life, people get in trouble trying to have too high of a task demand or too big of an ask, and navigating in that world and keep trying to do that and grind that gear over and over again rather than pulling it down and then building it up.
Yep, just like any other thing in life, any behavioral expert out there will tell you, if you want to become a marathon runner, you don't start running for 4 hours a day, and you start easy and you build it up, and that's the same model we're using here.
Mm-hmm. Yeah, and even like with exposure therapy, if it's too hard and the person is not not willing to do the behavior, then you got to lower the criteria to make it more obtainable so they could actually successfully do it with repetition.
Yep. And so we're using that data to decide within PDI, when do we move on to the next challenge? If the parent's having great success using the skills at home, getting their practices in, they come in and they say, yeah, oh my gosh, he'll listen to every single thing I tell him to do. He just does it right away. It's really easy stuff that we're telling him to scoot his chair up and draw a circle. And it's not that hard of stuff, but he just does it right away. Then we know we're ready to give the next step of a little bit more challenging commands. If they're coming in and saying, I'm not practicing, they don't understand, they're not following this stuff, I just haven't gotten the hang of it, or we're seeing in coaching that the format is really not being followed the way that we have taught it, then we coach it for another week until we are ready to move on.
You mentioned pride skills last time. Is there an acronym or a skill base that we're doing in the parent module?
There is no acronym, but we do talk about, Dr. Gibson talked about the foundation of your house. We call it the stairway to success. And it's this visual with the base is CDI. And then we've got the play commands during our special time. And then we've got 2 to 4 commands throughout the day. And then we're working on commands being used all throughout the day as needed. And then even towards the top, we've got something called a house rule that results in an automatic consequence. And then we can do public outings and sibling sessions to really generalize those skills to other areas. So not an acronym, but a visual that we're climbing a staircase the whole time.
Okay. I kind of want to help people like tangibly like think like if I was going through this or doing this therapy, what this part of the therapy, what would this like actually like look like? And so is there a specific way that we're having them do commands? I know that you mentioned timeout. When are we doing timeouts? What do they look like? Is there other components besides the commands and the timeouts in this section?
Sure. I think one thing that we didn't really explain is that we're teaching the skills to just the parents. So for each phase, we have a session without the kiddo where it's just us and the parents, and it's a teaching session where we're diving in and we're giving all of this information and explaining all the skills without the kiddo there, wanting attention and wondering when someone's going to play with him or her. So that allows us to really dive in and get reactions about and practice. We role play the different elements also.
We
So
use Mr. Bear. Mr.
Mr.
Bear.
Bear.
One of the Mr. Bears is here. We pick him up and we put him in the chair. It's lots of fun.
Yeah. So we start out by teaching in the parent-directed interaction those guidelines for effective commands. And then in that same session, we're running through the script for timeout and helping parents already begin practicing those words and those phrases. And as Corey was saying, we start out with really easy commands. So there's kind of a structure in the manual that we start out with commands in play because they're a very low degree of difficulty. Then the next step on that staircase would be to start having the child do some cleanup related commands. And so we're stepping up that difficulty gradually, but we're coaching timeout from the very first session if we need to. If the child complies with every command, we don't need to coach a timeout because they've cooperated. So we might get a timeout in the first session. We might get a timeout in the third session. Often, I mean, we're dealing with disruptive kids, so often we get a timeout early on, but sometimes we don't. And sometimes parents will be like, well, he's not getting timeouts or she's not getting timeouts. And it's like, true.
Good.
She's following all your directions. So as long as you're giving directions and she's following them, then, part of your goals are being met. So the goal isn't necessarily to get a timeout. It's to get cooperation. But we're prepared from that first session that there could be the potential for a timeout. And like Corey said, it's just going to be broken record, repetitive, and a boring experience for the child. And they're going to get their parents' attention back at the end of it. So in this procedure, we always give another command after the timeout is over and the child has obeyed it. So an important part is for timeout to be over, the child needs to obey the command. So if I could just go sit in a timeout and then not have to give you the crayon, maybe it's worth it to me to go sit in a boring chair because then I get out of doing the thing. So we need to close that loophole. So timeout only ends when the direction has been followed through with. So we're closing that loophole that way. Then we give a follow-up direction. Usually that one is obeyed right away. If it's not, we could end up in another timeout. But if that follow-up direction is obeyed right away, then that child is going to get immediate enthusiastic praise, and they're going to see, oh, when I follow the direction right away, I get that warm parent back. So that's how the sequence is ending. It's ending with cooperating with a direction right away, whether it's the second or third direction, however long it takes for us to get to that point.
How long is the timeout? Roughly?
Yeah. Hold on just a second. So we could do an entire other podcast. This is the book that Dr. McNeil and I wrote. It is, 100 and some pages, all about all of your timeout questions. But in timeout, or in a therapeutic timeout, we call it a therapeutic timeout because, like Dr. Gibson said, so many families use timeout and they'll say it works or it doesn't, but very rarely does a family follow it to a therapeutic level the way it was designed in a scientific laboratory. And so it's timeout from positive, or timeout from reinforcement. And so all the research shows that shorter timeouts are just as effective as longer timeouts. And so for the sake of convenience and ethics and all of those things, 3 minutes is what's been used in PCIT, and over 50 years of research, it's effective. And so we stick with the 3 minutes. There's some information out there about using the number of years of a child's age as the number of minutes. There's really no science behind that. It's just kind of something I think that sounds catchy, and so it's gotten spread around. Nothing wrong with that, but if you can accomplish it in 3 minutes, even if you have a 6 or a 7-year-old, then I think it's easier to do. So we require 3 minutes in the chair. You have to stay on the chair. You have to not stand, not tip the chair, and not scoot it towards something. And again, our guiding principle is we want it to be boring. We don't need the child to feel ashamed. We don't need the child to know that the parent's upset with them. We don't need the child to even think about what I have done to earn this. All we need them to do is get bored. And the more we pair non-compliance with boredom following it, the more the child learns. So even children who can't fully understand, can't verbalize back to us, why did you go to timeout? Well, because I did X, Y, and Z. It's just pairing that behavior with that consequence. So 3 minutes on the chair, and then we're going to ignore any type of other behavior that happens on the chair. So we'll have kids who yell how much they love their parents and yell how much they hate their parents, and do all kinds of behaviors, hang upside down and whatever they can think of to do. And we're going to ignore all of it as long as the child's safe and they're not violating one of those rules, basically about either safety or getting off of the chair and making it fun. If they are sitting after 3 minutes, they have to be quiet for 5 seconds, because we don't want to reinforce any behavior that happened right at the end. So when the parent comes over and says, you're sitting quietly on the chair, are you ready to hand me the crayon, or whatever the command was, we don't want the child just to have 2 seconds before have said, F you, mom, and now they think that's the reason mom came over. So we have the parent kind of stand there and wait for 5 seconds of silence, and then the child, like Dr. Gibson says, has to follow that original command, has to follow a follow-up command.
Is timeout the only type of punishment system that's going on, or and I'm thinking outside of the play, just in life, sometimes kids do bad behavior, like biting somebody or something like that. Is there a higher order punishment schedule that we have?
So until we get to the part where we're teaching commands, we tell parents to handle discipline how you typically would. So outside of that 5 minutes a day, handle it how you normally would, and then we will get there when we work up to that step. But once we are at that step, one tool we have parents use a lot is giving an incompatible command, we call it. So if a child is pulling the parent's hair, you could give a command for the child to go sit on the couch, and they can't possibly continue to pull your hair while they're sitting on the couch. And if they choose not to comply, then we can jump right into the warning statement and the timeout procedure. So we kind of plug the behavior into a situation that we can use a command and really try to follow that. And then past the command phases where parents are using commands throughout the day, child is highly compliant, we're getting very few timeouts, maybe 1 or 2 a week, then we will go on to the house rule phase. And a lot of times parents will pick physical aggression as one of their house rules. So they can have 1, maybe 2 standing rules of a behavior that is absolutely never, ever acceptable in my house. And so sometimes we even have to specify physical aggression so that we allow for things like play fighting and wrestling that siblings or parents and kids want to do from time to time. So a common house rule would be no hurting to be mean. And so then you earn an automatic timeout when you engage in that behavior. Because if we give it a warning and get the child a chance to change their behavior, they basically have one free pass every time to hit and then stop, hit and then stop. So physical aggression is usually treated at the house rule phase, at least in my patients.
Okay, and if timeout is not successful, meaning the child is not engaging in the timeout, then what's the next step there?
You want to take this one?
Sure. So we have a procedure for shaping sitting in the chair, a backup procedure. So we use a room, which we talk through with the parents or caregivers to figure out what room in their home makes sense. But basically a room where they're not going to be having much fun, again, boring. We know at this point we've boosted up their interest in their parents' attention. So we're using that to our advantage. If they're in the chair, they can still see their parent. If they get off the chair, they go to a boring room, the parent's not in that room. They have to be in that room for a minute. Then they go back to the chair. So just like with timeout, we go back to the command. If they get off the chair, that doesn't shorten their timeout. They still have to go back to the chair, and it doesn't end until they've completed their timeout in the chair, but they might go to this boring room, back to the chair, boring room, back to the chair, if they won't stay in the chair until they learn to just sit in the chair, because it gets them back to real life and back to getting positive attention from their parent. Because I think that is a big pitfall, is a lot of kids, they just get up from the chair. And so then, that's what a lot of parents have struggled with. I can't get my kid to actually sit in the chair. So we're using a backup procedure where they're getting even less access and attention from the parent in order to shape them sitting more cooperatively in the chair.
Is there any like losing your iPad privileges or, things like that are built into the protocol, or is it really built on the losing the attention?
It's
Yep.
built on boosting
Standard
up
PCIT,
parent attention
and
and
we can talk
losing
more
it.
about the adaptation for. Oh,
Go for it.
I think we're losing signal a little bit. I don't know if we're synced up.
Yeah, it will catch back up. Okay, and one last question in this domain is, what is an effective command? Like, what are the skills that you teach when you tell a parent, "Yep, that was an effective command"? What does that look like?
So there are 8 rules. We give this handout, and it looks like a lot, but that's why we give the handout. So we are telling rather than asking, so that a child can know the difference between when I am choosing to give you a direct command, you have to do it. It's not a, hey, let's start to clean up, or do you want to go pick out what you're going to wear? It's hold my hand if they're about to cross the busy street. We are giving them one at a time, so that if a child doesn't comply, we know they chose not to, versus I gave you 3 things to do in a row and you just forgot one of them. We are telling the command, and then we are staying quiet until they either comply or don't comply. So if we need to give some type of a reasoning ahead of time, like, hey, it's really cold out today, we're going to have to wear coats. Before we give a command, please put on your coat. Then we stay quiet until after the child has either complied and we give that labeled praise, or if they choose not to comply, then we're following through with our warning and our consequence. Dr. Gibson, do you want to jump in with some more? I don't want to take them all.
Sure. So we want it to be positively stated, telling the child what to do rather than what not to. So it might take me 3 times trying to rephrase something. If I start with "don't run in the parking lot," and I want them holding my hand, it's better to just start with "please hold my hand" versus "don't run." Now they're skipping. Well, no, don't skip either. So just tell them what you want rather than what you don't want. Make sure it's developmentally appropriate, because we're going to give a consequence if they don't follow the directions. So we want to make sure that they understand what we're saying and are capable of doing it. Otherwise, it's not a good time for a command. We want to use them when it's necessary, when we're willing to give a consequence if it's not completed. And we want to role model calm, nice language. We don't want the child relying on us getting to that angry tone. We want them to learn to listen when people are calm and polite. And so we want that command to be delivered in a neutral or positive tone.
As a native New Yorker, how was that transition to that type of presentation?
I use please first. It helps. Please do X. Please do Y.
Yeah, I think it almost serves as a cue for the kid. If they hear, sometimes parents will say their name too. Like I might say, Benny, please hand me. And so if they hear Benny, please, then they go, oh, we're going into that. That means business. Instead of you having to get your stern mom voice or use their middle name or whatever you've been using before as a stimulus. Another common one that parents will do a lot, even when in coaching, they'll ask. I think we're used to asking to be polite. Hey, can you please hand me, or will you please hand me? Which is really nice, but they can't tell the difference between which ones they have to do and which ones are just suggestions. So I feel like that's what I work with parents the most on.
Okay. Any final thoughts about the parent-directed section of PCIT before we wrap up and move to talking about older children?
I will just say that my favorite thing about PCIT is PDI, and particularly after a child has gotten a timeout. It's usually pretty emotional for everybody. Parents are kind of sometimes physically sweating because it's stressful. You're being watched. Your child's upset, and it's really a lot. But almost always, in my experience, like 99% of the time, the next session, the kid is so excited to come. Everyone's in the family's kind of thinking, oh, they might not like it anymore. They might be upset with me, but they want to come more than ever. They'll just come in and say, I'm going to listen today. They feel so proud of themselves. And it is just the most rewarding part of my entire job. And then along with that, I think some people have concerns about timeout, about discipline in general, and the fact that it might be scary or somehow damage a child. And just to put a plug out there, that there is not one piece of research evidence showing that there are negative effects of timeout. And in fact, it is associated with reduced trauma symptoms, even in kids that have trauma histories. There are ways that we can adapt it to make it more palatable or more comfortable for certain kiddos, certain families, and there are those extenuating circumstances. But the issue of having inconsistent discipline and disruptive behavior and lots of unpredictability in the environment is far more damaging to kids, and this procedure is actually really healthy and beneficial.
And any last thoughts for you, Kate?
I think that was a fantastic summary. I might just add that even in the session where a timeout happens, we don't end until we've gone back to the child-directed interaction. And you can see even within that same session, the child re-engage and be happy again and, warmly interacting with their parent. And it's really fast once the timeout is over, how quickly they're able to re-engage and just get back to baseline.
I really like the positivity thread through this therapy. It's really about creating a really strong relationship with your kid, and that relationship and that positive relationship being the mechanism of change rather than it being more punitive based or taking away things, where we're using connection and positivity in order to create the household and the family interactions that you're looking for. Yeah. Before we jump, Corey, you had picked up a book, but you didn't actually say the name. And I said it in the beginning about Timeout, but just in case somebody's going, what is this Timeout book? I have to have it. What is it called?
It is Timeout in Child Behavior Management, by me, Dr. Lineman, and Cheryl McNeil, who is, if you're a child psychologist or a psychologist, everyone knows who Dr. McNeil is. You can get it on Hogrefa's website. You can get it on Amazon. It's really cheap. It's maybe 20 some bucks. So it's geared towards therapists. So if you're a parent, it might be a little bit technical and dry, but it's geared towards therapists and graduate students and professionals in this field. Teachers, I think, can benefit from it too.
And if people want to get resources and trained about the original PCIT treatment, where can they go to do that?
PCITinternational.org is a great resource for finding the trainers.
Can you find clinicians too? Is there like a clinician roster?
So there's information. There's a list of certified providers by geographic location.
Yeah, it's got a cool interactive map. You can zoom into your area and find a little dot and read about everybody that's on the listserv.
Okay, and can they train with you if they want to, if you guys are taking on
sure,
quote unquote trainees?
Absolutely.
So okay. I am actually going through certification this year to become a regional trainer. So I'm hoping to offer more of those trainings. But right now I just train people within UNMC here.
Yes, likewise. I train people within my practice, and I'm going through that same next step to be.
Oh, nice.
Yeah.
Okay.
Regional.
All right. So we're going to take a pause here. Come right back to the next episode to learn how we do parent-child interaction therapy with older children.